We're joined today on Health Matters by Dr. Geno. Dr. Geno, it's good to see you again. You've been with us before. We're glad to have you back. Cholesterol is something we may not think about until we get our physical and the doctor goes, well, your good cholesterol is fine, but your cholesterol is a little high. We need to take a look at some different issues. You're going to share with us today that those of us who may think it's all about diet could be mistaken. There's other things involved. What would you want our viewers to know about cholesterol as it relates to them and their personal health?
One is the cholesterol that you've got in your body, the vast majority of it, you made yourself in your liver. And it's made from a breakdown of sugars and proteins. And actually that whole process is stimulated by insulin and glucose. Every carbon is from acetyl-CoA, which is a biochemical pathway. However, so what you eat, the cholesterol that you eat isn't necessarily what's in your veins. The vast majority of it you make, and the medications that are given, the statin drugs, stop the rate-limiting step in the formation of cholesterol in your body. The HMG-CoA reductase is what is tightened up by the statin medications, so that you have less cholesterol in your body. Now, your body needs cholesterol for many things. It uses that form to make testosterone, estrogen, aldosterone, cortisol, amongst many other things. It also is put into the cell walls to make them more fluid. It's a fat-soluble molecule. Your body has to move it around. And you're a water-soluble person. So your body makes proteins, lipoproteins, that carry it around. HDL and LDL are two of the major ones that you look for in the tests. Mm-hmm. The LDL, the lousy cholesterol, your body makes the lipoprotein in your liver. It fills up with the cholesterol, goes down to your big toe and drops it off. The HDL, the happy cholesterol, lipoprotein made in your liver, goes down to your big toe, picks it up and brings it back to the liver. So you want more of those. The way that you have more and less of those, the statin medications make a difference. A good diet and exercise also make a difference. And the aerobic activity tend to increase the HDL. Also, that's part of your genes as well.
Cholesterol in totality is necessary and good and does a lot of good things in our body.
Exactly.
The lousy cholesterol you mentioned, does it cause, in layman's terms, does it cause our arteries and things to start clogging up because that bad cholesterol is there? What is the medical challenge of the bad, lousy cholesterol, as you call it? What does it do to us?
Well, it increases the plaques that form inside the vessels. And when you have vessels in critical places, in your heart, in your neck, in your brain, and various other places as well, those bottlenecks that are necessary for survival, those things need to, the cholesterol can cause damage to occur in those places.
How high are the numbers, or how out of balance would the good and bad be, if that's a proper way of saying it, before a physician will start going, we need to put you on at least some low dosage statin drugs? Is that what you called them?
Well, it used to be that we would treat just the numbers. Mm-hmm. At this point, the national guidelines are to treat risk factors. If you have hypertension, if you have diabetes, those are things that we tend to treat for risk factors. And there's various cardiac risk calculators that are downloadable, where you're going to have a calculation of your cardiac risk in the next 10 years. If you have a 10% risk, you're going to be probably on a high-dose statin. So it's not necessarily just treating the number, but treating the risk factors.
As we age, if you examined me over every year I see you, and you see the concerning numbers growing a bit, if you tell me you can help this on your own without me giving you any drugs, by exercising, by eating a better diet, can I not only stop the increase of the bad number or actually bring it down by lifestyle changes alone?
You can make some changes with lifestyle, but the biggest changes are going to be with the statin medications. People who have the risk factors are going to do better, at least at this point, with those medications. You certainly can make a difference with your diet and exercise. But like I'd mentioned before, the cholesterol in your body, most of it you made. and you want to try and not make quite as much. Diet and exercise do make a difference, but if you already have heart disease, I wouldn't suggest that you do it with diet and exercise alone.
You've been practicing medicine for a while now. This is your area of expertise. Are we making strides and improvements in those drugs and doing a better job because of research and smart doctors? Are we doing a better job of dealing with high cholesterol problems in patients?
We're doing a job with dealing with high cholesterol in patients. It's just becoming more evident when those medications are needed. I wish the medications were reversing the process more. Mostly it's keeping it from getting as bad as quickly. Also, I wanted to let you know, if somebody has no risk factors and they're 75 years old, there's not really the need necessarily to put them on those statin drugs at that point.
You're not going to accomplish enough to justify the use of those drugs for someone 75 that doesn't appear to be at risk of heart attack, stroke, or something else. Is that right?
Well said.
Okay. Well, I listened to what you said and just kind of repeated it back. I'm 65 years old. I'll be 66 in February. I get my physical this coming week. My numbers are fine. I need to keep getting my physical all the time. You don't want people as they age to give up on annual physicals because these numbers need to be monitored. Even if you might not assign a statin drug to me for cholesterol issues, there are other things to watch very closely, and I'll make that my last question. Don't stop monitoring this.
That's the definition of a preventive visit. You're trying to prevent things from happening. A treatment visit is somebody comes in, they've already got the problem. You're trying to keep the things from happening altogether.
So keep going to my doctor every year, just like I'm supposed to.
That would be a perfectly good thing to do, and if you have those chronic illnesses, probably even more than that.
Dr. Ed Geno, thank you. We enjoyed talking to you. Thanks for taking complicated subjects and making them where we can understand them. I appreciate it.
I enjoy it.
Thank you.